Good morning, everybody. Thank you for joining us here in the new year. Happy New Year. For the state's response to the pandemic, we will get right into it today by reminding folks that, again, while our hospitalizations are down from where we were before the holidays, and we are into the blue category, which means that we do have a 75% limitation on indoor venues. A lot of the other things we had in our DHMs have moved into guidance, with the exception of the quarantining and isolation. That is still in the DHM. So while we do have looser restrictions right now, we do need people to continue to practice all the tools that we have to help slow down the spread of the virus. So that means keeping that 6 foot of distance between you and other people when you're out in public, wear a mask when you go to the store, wash your hands often. A big one is, please make sure, stay home if you're sick. That's one that's going to help slow the spread of the virus. Work from home if you can. All these things will help us make sure we slow down the spread of the virus, and that's going to be key as we go forward. Also, avoid those avoid the 3 C's, those confined spaces, close contact, crowded places. And it's a virus that spreads from one person to another. So if you avoid those opportunities for the virus to spread, we'll generally slow down the spread of the virus overall. All right. And of course, all of that is designed to be able to help protect our hospital capacity. Right now, we are at 36% of our hospital beds are available, 36% of our ICU beds are available, and 76% of our ventilators are available. So we want to make sure we continue to be able to provide that hospital bed, that ICU bed, that ventilator to anybody who needs it when they need it. All of us can be part of the solution to be able to help slow that down. Also, another great way to be able to help fight the virus is getting tested through Test Nebraska. Go to testnebraska.com, you can sign up, find a place to get scheduled. We're working to continue to provide that great service, that turnaround time of 24 to 48 hours. Last time I went, I think I got my test results back in like 12 hours. So again, Test Nebraska is out there. Great way to go out and get tested to make sure you don't have the virus. We have delivered over 579,000 test results back through testnebraska.com. All right. So today we've got a number of guests that we're going to have. Angie Ling, who's been here before. She's our incident commander with the Department of Health and Human Services, is going to talk about an update to our dashboard with regard to the vaccines. We have delivered over 36,000 vaccines. We're working to, again, prioritize our healthcare workers, our frontline healthcare workers, and then our folks in our long-term care facilities, both staff and residents. So Angie's going to give us an update on that. And then also we've got an exciting announcement from Monolith Materials, but also including Norris Public Power and Nebraska Public Power Districts. So we've got Rob Hansen, who is the CEO for Monolith Materials. Also, Bruce Fadash, who is the CEO for Norris Public Power, and Tom Kent, who is the CEO for Nebraska Public Power, to talk about an exciting announcement. I'm not going to give it away, though, so don't get worried. But they've got an exciting announcement they're going to talk about today that we're really pleased to be able to share. Okay, let's see. And, I also should mention that Rob Hansen is also the co-founder for Monolith Materials. So, exciting company, which I've talked about Monolith Materials in the past. This part I can say, this is not letting anything out. Monolith Materials has a patented, unique way to crack natural gas into carbon black, the stuff that goes into tires and into cell phone covers and a variety of different things, and crack it into that carbon black and hydrogen in a very clean, environmentally sustainable way. And of course, hydrogen has lots of industrial purposes and uses, and carbon black is usually made from petroleum in a way that is going to be a carbon-intensive, typically, type process. So this is the first carbon black factory, I believe, built in our country in the last 25 years. Is that correct? Yeah, Rob's nodding his head. So it's very, very exciting that we've got it here in Nebraska, and I'm very pleased to have all 3 of these gentlemen here to be able to talk more about that. So with that, though, I'm going to ask Angie Ling, and again, just on the hospitalizations, again, 511. I mentioned this, we're in the blue category. That's down from where we were before the holidays, but we want to continue to, again, slow down the spread of the cases and protect our hospital capacity. Angie Ling, though, is going to come and talk about what we're doing, an update to this dashboard that has to do with our vaccine program. So Angie, would you please come up and talk to us about that?
All right, good morning, Happy New Year. As of today, we have received 63,070 doses, primary doses in the state of Nebraska, and 23,400 primary doses to the federal pharmacy program for long-term care facilities. This is a total of 86,470 doses in the month of December. Also, our first shipment of Pfizer second doses arrived late last week. This week, we will receive 11,200 doses of Moderna that will go to healthcare providers and 11,700 doses of Pfizer that will go to the federal pharmacy program for long-term care facilities as well. Last week, over 100 long-term care facilities were vaccinated by the federal pharmacy program and many more by local health departments and community pharmacy partners. Shipments of vaccine product continue to go to Phase 1A providers to include hospitals, community health care providers, federally qualified health centers, pharmacies, and local health departments. The prioritized tiers for Phase 1A and Phase 1B are located on the DHHS website under vaccine information. As we prepare for Phase 1B, we will be working with the local health departments and community partners to help with vaccinations. Citizens aged 75 and older will be the priority for Phase 1B. Vaccinations will be accomplished through multiple methods, such as community vaccine clinics with the local health departments, healthcare providers, and pharmacy partners. We are still finalizing those details, and we'll get this information out as soon as possible. In most areas, this phase will not start for another 2 to 3 weeks, so we ask for patience as we finalize these details. We will be introducing a website in the coming weeks for citizens to register for vaccinations so they can be informed when their priority group is ready to be vaccinated, and also to assist with scheduling and follow-up reminders. A reminder that the state will be moving through the phases asynchronously. This means that while we are still focusing on healthcare in one area, another area may be starting on Phase 1B populations. The vaccine dashboard is available on the DHHS website. You can find it in the same location as the COVID-19 dashboard, and you toggle with this banner right here. You just click on that and it'll toggle you to the COVID vaccine dashboard. Here you will find total vaccines distributed within the state, total vaccines administered, number of first doses received, number of second doses received, and the percentage of population 16 and older to be vaccinated. This will be updated every day at the same time as the COVID-19 dashboard. This is also important for the total vaccines administered. When we have other vaccines that might not require 2 doses, you will see that incorporated in there as well. So it'll take into consideration 1 dose or 2 doses. We will continue to provide weekly updates, and we look forward to the ongoing efforts to get Nebraskans vaccinated. Thank you.
Thank you very much, Angie. And I'm glad you pointed out that we got the little yellow toggle bar up there, because when it first went live, I'm flipping through the tab down below and I'm clicking like, where is this tab? Where is this tab? Oh, you mean the big yellow one right up top, right in front of my eyes. So thanks for pointing that out. I appreciate it. And thanks for all your work on organizing our vaccine program too. So with that, now I'd like to go ahead and call up the folks from Monolith Materials. We're going to start with Tom Kent, who's the NPPD President and CEO, to talk about NPPD's role in the expansion of Monolith Materials.
Thank you, Governor. Thank you for being here today and allowing us to celebrate this announcement and this occasion with you. Welcome. Happy New Year, everyone. Just as Nebraska is a business-friendly state, NPPD is a customer-centric utility. Monolith approached this earlier this past year with a desire to achieve 100% renewable electricity supply for the Olive Creek facility. Even though NPPD's generation mix is already more than 60% carbon-free, we went to work forging a path forward, a path that will work for Monolith and for NPPD and for all of our customers. Today, we're pleased to announce that we signed a letter of intent with Monolith, which is poised to become the largest electricity consumer in the state, outlining our intention to procure sufficient renewable energy resources to generate approximately 2 million megawatt hours of electricity annually. This clean generation will create enough renewable energy certificates to match Monolith's annual energy usage and meet their environmental and sustainability goals. While NPPD will be adding significantly to our generation mix, our agreement will allow us to continue to maintain our highly competitive rates and top-notch reliability. These were key reasons for Monolith to move its operations to Nebraska and are critical careabouts for Nebraskans across the state. We anticipate putting out a request for proposal in March and having the projects in service no later than December 31st, 2025. I say projects because due to the amount of energy needed, this is sure to be a mix of multiple projects and will likely include wind, solar, and potentially some energy storage projects as well. Our strong preference is for this investment to take place in the state of Nebraska. The location of these projects is yet to be determined, but I want to stress that we'll seek to locate these projects in areas that meet the following goals. First, timeliness. Given our timeline, it's likely that these projects are already in the Southwest Power Pool generator interconnection queue. Developers will have had to have done significant legwork ahead of time, acquiring agreements with landowners and easements to meet the criteria in the request for proposal. Second, local community support. This is very important to NPPD and for Monolith. And finally, third, cost. The price is going to need to be right for this to work. We're proud that this will complement our already diverse energy mix, which is among the cleanest in the region, thanks to nuclear, hydro, wind, and solar resources. And we are excited to help facilitate Monolith's growth in the state of Nebraska. At this time, I'd like to turn it over to Bruce Vitosh, our valued customer and partner. Norris Public Power District will be delivering the energy to Monolith.
Thank you, Tom. I am pleased to be here today as part of this exciting announcement for one of Norris Public Power District's valued customers, Monolith. NPPD and Norris have a long and outstanding relationship that enables customers like Monolith to realize the benefits of public power: competitive costs, reliable and resilient service, along with excellent customer service. We provide all of these benefits safely while being dedicated to operating in a sustainable and environmentally responsible manner. Public power has long benefited Nebraskans, from extending electric service to the most rural parts of the state, to keeping rates low, and our focus on our customers. NPPD and Norris entered into discussion with Monolith more than 6 years ago, with hopes that they would locate their operation in Nebraska. Working together, NPPD and Norris explained and demonstrated how Monolith would benefit from receiving power and electric services from a public power organization in Nebraska, and how those benefits will continue into the future. Today's announcement is an example of one of the many benefits of public power. Norris is willing to listen and accommodate our customers to help them fulfill their power supply needs, especially as the electric industry evolves. More and more customers are interacting with Norris to fulfill their renewable energy preferences through customer-owned generation. Norris has and will continue to evaluate renewable energy opportunities as allowed in our long-term contract with NPPD. Because of our relationship with NPPD, Norris can accommodate Monolith's desire for the utilization of enough clean and renewable energy that is equivalent to power their manufacturing facility. Monolith's Olive Creek 2 facility will be an extremely large consumer of electricity. Monolith has rate options that are available to them. Monolith will have the opportunity to utilize an economic development rate in the early years of their operations and are evaluating rate options that are available once the economic development rate term expires. We are pleased that Monolith is able to achieve their environmental and sustainability goals through the use of renewable energy credits to meet their annual energy usage. Norris looks forward to a long and mutually beneficial relationship with Monolith and their continued investment into the state of Nebraska. So at this time, I will turn it over to Monolith co-founder and CEO, Rob Hansen.
Great. Well, thank you so much, Bruce, and thank you, Tom, and thank you, Governor. We wouldn't be here were it not for the three of you, so very much appreciate that. Monolith was founded to have an impact, a positive one, economically, environmentally, and sustainably. And I want to just take a few minutes today to talk about the impacts that we're having across those spectrums. So on the economic front, at Monolith, we produce essential products. These are products that help underpin our economy and our society. We make hydrogen, Hydrogen's key to the energy industry. It's also a critical building block. And at our plant here in Nebraska, we're going to be producing hydrogen and converting it into anhydrous ammonia, the mother of all fertilizers. This is fertilizer that helps our farmers grow the corn, that helps feed the world, and helps fuel the world. Currently, Nebraska and the country are net importers of ammonia, and we're hoping to start changing that, which will be good for farmers, it'll be good for the state, and it'll be good for the country. We also produce a solid product called carbon black. Carbon black is essential to the transportation supply chain. It's found in the paint of your car, under your hood in belts and hoses. If you drive an electric car, it's in both the anode and cathode of the battery. And most importantly, carbon black makes up 1/3 of every single car tire on this planet. The US also imports carbon black on a net basis, and we're already starting to turn the tide on that. Our plant began producing carbon black in 2020, and in 2021 we're going to ramp it up and start supplying customers around the country. But Monolith is about more than just economics. It's also about producing these essential materials sustainably, and that's what today is about. Electricity is our #1 input to our process. And in partnership with NPPD and Norris, we'll be powering our plant with 100% renewable, 100% Nebraskan electricity. This allows us to have the big economic impact while having a tiny environmental one. Look, this is not about shipping renewable electricity out of the state. It's instead about producing it in-state and then converting it into high-value products at one of the most sophisticated manufacturing plants in the country. When our plant is fully built out in 2024, it will reduce greenhouse gas emissions by over 1 million tons per year. That's equivalent to taking 400,000 cars and switching them from gas to electric. That's more than every car in Lancaster County combined. So that's the type of environmental impact we're talking about. And then finally, Monolith is about positive impact on society. We sum that up in one word: jobs. We've already created close to 100 high-paying advanced manufacturing jobs, most of them here in the state. And we intend to create several hundred more over the coming years as we grow. Now, these aren't jobs that you just scrape by on. No, these are jobs you can build a career on. These are jobs you can build a family on. And we're really proud to be able to have that type of impact. We're hiring, so please check out our website, monolithmaterials.com/jobs. We first came to this state, which I now call home, in 2015. And the governor, Tom, Bruce, you've been with us every step of the way. 2020 had a lot of tough parts to it and a lot of steps backwards. And 2021 is going to be tough too. But I'm really excited today to be taking a big step forward as we announce this advancement in the project. So thank you all. And now I'll turn it back to the governor.
Great, thank you very much, Rob. And I also want to mention that you originally started this company in California, but you moved your manufacturing headquarters here to Nebraska, and that just to reemphasize that you moved here as well. So thank you very much. We're glad to have you here in Nebraska. So again, exciting announcement today. And one of the other things I really love about this announcement is that it is market driven. That this is the customers asking for renewable energy. It's not a government mandate. This is the way it's supposed to work, that the market drives this, and this is what's going on here. And also, and talking with Tom Kent earlier, again, as you create more demand, this 2 megawatts worth of power, that's going to help make sure that everybody who is in NPPD has their rates maintained, because again, you can spread that out over a fixed cost base. That will help keep everybody's rates low. So this really is a win-win-win for everybody, and congratulations to all of you. Congratulations, Rob, from Monolith Materials. Congratulations to Norris Public Power, and congratulations to NPPD. We really appreciate it. Great stuff, exciting stuff. All right, very good. Just before we get into Q&A, just a reminder on the upcoming schedule. Prior to the holiday break, we've been doing press briefings on Monday, Wednesday, Friday. We will continue to do that with some modifications. So on Wednesday, the legislature will be gaveling in at 10 a.m. So we are going to move our press briefing to 9:30 a.m. and we will do that. We will have a very short press briefing in recognition of the legislature gaveling in at 10 a.m. They'll be going through their process to get the legislative session going with rules and leadership elections and so forth. So we're going to wrap this one up before 10 o'clock when the legislature gavels in. And then we'll also be back here again at 10 a.m. on Friday for the press briefings to round out the rest of the week. With regard to questions, okay, we've got KMTV Jennifer Griswold. Are we tracking the number of people who have denied a vaccine, the people who didn't want to get one dose from those who have been offered one? And no, we actually are not tracking that. So again, the vaccine is completely voluntary. The state is not going to mandate that anybody gets a vaccine. It is incredibly effective. Both Pfizer and Moderna are in the category of 95% effective. Some of the early data shows that you get a lot of that protection from the first dose, even before you get the second dose. So it is completely safe, as we've had folks come up here and talk about in the past. It's not going to microchip in it. It's not going to change your DNA, nothing like that you might read on the internet. None of that stuff is true. So we certainly encourage people to get it, but it is going to be entirely voluntary. And then her follow-up question is, if so, what are the numbers? And we don't, since we're not tracking that, we don't have any of the numbers don't have it broken down by any groups. Taylor, I believe you've got some other questions?
Got several other questions. Don Walton is asking, are you satisfied with the pace of coronavirus inoculation?
So Don Walton, the Journal Star, is asking, are we satisfied with the pace of the inoculations? You may have seen last week the New York Times did a story where Nebraska actually ranked number 2 as far as the percentage of vaccine that we had pushed out. Did slow down a little bit over the holidays. We expect that as we have more vaccinators come back from the holidays and more people coming back to work after the holidays, that pace will pick up again. I believe we're in the upper third of states right now, so we expect to continue to push to get more vaccines out.
His next question is, do you believe Congress should accept the Electoral College results?
So Don Walton's also asking, do I believe Congress should accept the Electoral College results? Again, this is part of our process for how we elect a president. I believe if you go back and look at the last 3 Republicans that were elected, Democrats objected to those, including Barbara Boxer. So it is not unusual to see people object. Certainly the Democrats have done it the last 3 times a Republican was elected. And I believe that the goal of the senators who are, the Republican senators who are looking to object, is to get Congress to create a commission to investigate voter fraud. I think with the substantial number of people who are questioning the integrity of our voter system, it would be good for Congress to do that, to make sure that in future elections people can have confidence with the way those votes. But at the end of the day, yes, Congress should go ahead and certify the results of the Electoral College.
Chris from NTV has a series of questions. His first one is, he says that meat plans are up for our state's vaccination, next up for our state's vaccination plan. When that is implemented, will undocumented citizens or legal immigrants qualify for the vaccine?
So Chris from NTV is saying that in our state's vaccination plan, meat processing plants are up next. Actually, that's not true. They are in phase 1B, but we have several other groups that are ahead of meat processing plants in phase 1B, including the 75-year-old plus that Angie Ling just mentioned. So that will be further down the list. His follow-on question with that were, would people who are illegal immigrants be part of that? Again, you're supposed to be a legal resident of the country to be able to be working in those plants, so I do not expect that illegal immigrants will be part of the vaccine with that program.
Can we get some more information on how people can sign up to know when a vaccine is ready for them?
Can we get some more information to know when, so people know when they can start signing up for vaccines? And as Angie mentioned, we will have more information on that later. There will be a place where people can register so they can get notification when their group's up. So I'd say just stay tuned. We will have more information about that coming out next week.
Chris also asked, it's a new year, many people are financially struggling. Will the state be rolling out more financial assistance for those in need, like we did last year with organizations such as Compass and the Jubilee Center?
So Chris is also asking, with the new year, does the state have more plans to roll out additional financial programs for folks? Right now, the state has actually got the second lowest or the lowest unemployment rate in the country. So there are jobs out there. We do know some people, though, are still struggling because of the pandemic virus. We had the programs last year to do that. If the federal government creates new programs, we will certainly administer those going forward.
And then his last question is, can we get an update on flu numbers? That might be something we need to look for HHS.
So, and then finally, Chris from NTV is asking, can we get an update on flu numbers? We do not have those handy here, but we can certainly come back to you with that and get you updated on that. So Taylor will take that offline with you, and then that's a good topic we can bring back for a general press briefing just to kind of make people aware of where we are with regard to flu numbers.
Martha with the World Herald says, why are the number of vaccinations given lagging so far behind the number of vaccine doses distributed?
So Martha Stoddard of the World Herald is asking, why are the vaccines lagging behind the number of vaccines being distributed? And again, just a function of the holidays. I'd point out that, again, a week ago, we were number 2 in the nation with regard to the percentage of vaccines that were going out relative to the number of vaccines that have been delivered, or I guess it was relative to the percentage of population. And we're still in the top third of that category right now. And with more vaccinators and people who are working to get the vaccine coming back from the holidays, we expect that number to pick back up again. I think it's just merely a lag in the holidays, and you saw this all across the country.
She also asked, how will people be notified when they're eligible to get a vaccine, for example? How will people age 75 and older find out?
Martha is asking, again, similar to Chris, how will people know if you're 75 and older? Will you know that you're eligible to get the vaccine? I would say stay tuned. Next week we'll have more information about that, but there'll be a way for folks to register and be able to get in line to be able to get those vaccines. So just stay tuned. We'll have more information.
Paul sent a reader question earlier. Why don't Nebraskans have access to coronavirus tracing apps? And should that have been a part of the Test Nebraska contract?
So Paul Hamm of the Omaha World Herald is asking a reader question of why isn't the state of Nebraska using the cell phone tracking apps with regard to coronavirus. And we took a look at those. They haven't been particularly successful or well adopted. New York State, for example, rolled it out. They had about 1.1 million, or about 5% of their population, sign up for it. But only about 800 people were actually notified that they were in close contact with somebody because of it. That was even out of 2,700 people who had tested positive of it. So we actually put our focus around our contact tracing program and making changes there to increase our call completion rate. For example, sending the text out ahead of time so that people who have the virus or their close contacts will know we're going to be calling them, and that's helped us increase our close contact rate. So we took a look at it, just didn't think that it was going to be worthwhile given our focus on something we thought was more effective for Nebraska, which was the contact tracing program.
Chris Burbach has a series of questions. He says, what are the state's plans for making sure vaccines are accessible to people in communities of color, such as South Omaha?
So Chris Burbach has a question with regard to how are we making sure that vaccines are accessible to people of color, like in South Omaha. And Angie, you want to come up and maybe just say a few words about that? I mean, obviously right now we're focused on frontline healthcare workers and long-term care residents and staff. But Angie, maybe you can come up and talk about some of the ways we're going to be thinking about this as we roll it out more broadly.
Sure. So we're working with the community partners now to make sure that there's that when the time comes that there's equitable allocations and accessibility. We're also working on defining how to get vulnerable populations vaccinated in those higher categories as well, and what that looks like. So we're bouncing that off of data, and more information will come on that. But we are working very closely with the community partners right now to determine where the best place is and how to get those folks vaccinated.
There are a couple more questions that might be best for you. Chris is asking, where are they on the priority list?
Where are they on the priority list? So vulnerable populations will be in phase 1C. That'll be further defined in the coming weeks on what that looks like. That may be, because it's a very broad, vulnerable populations is a very broad category. So we will further define that in the next couple weeks.
Will vaccine doses be allotted to community health centers in places such as South and North Omaha and Grand Island?
Yes, so will vaccines be allocated to the community health centers such as South Omaha and where else? Grand Island. Yes, so we're working very closely with the federally qualified health centers to make sure that they have allocations, which many of them have already received.
And then his last question is, will there be mobile vaccination clinics in neighborhoods where people have less access to private health care and transportation?
Sure, so will there be mobile vaccine clinics in areas that don't have as much access? And that answer is yes as well. The local health departments are doing a fine job on looking at their communities and where they can have those clinics. So there will be multiple ways that people will have access to vaccinations moving forward. Anything else?
Thank you, Angie.
Julie Anderson has a question. Is Nebraska doing anything to monitor or sequence the new variant of coronavirus first identified in the United Kingdom and since ID'd in 3 states, including Colorado?
So Julie Anderson from the Omaha World Herald is asking about what is Nebraska doing with regard to the new strain of coronavirus that is allegedly more infectious, that was in the UK and now has been spotted in 3 states, including Colorado. And we actually are planning on having the briefing on Wednesday on that, so I'm going to defer till we get till Wednesday with regard to those questions.
Bailey Bischoff from 1011 has a series of questions. We've gotten questions about vaccines for those above 65. When will the vaccine be available for them, and why aren't they included in phase 1B?
So the question from Bailey Bischoff of 1011 is about age 65 or older. Actually, age 75 or older will be in phase 1B, and we expect those vaccines to start being available in probably about 2 to 3 weeks or so. We're still working through phase 1A, which is frontline healthcare workers, long-term care staff, and residents. But we expect to probably get there probably 2 or 3 weeks or so. So again, we'll have more information about how people can sign up and get registered and be able to get access to that down the road. So was there another question on top of that though,
Just
Taylor?
wanted to know why 65 and above wasn't in 1B.
Why is 65 and above not in 1B? Because the ACIP came back with 75 and above, and so we're following their directions.
She also asked what percentage of the people eligible for phase 1A have been vaccinated, and how close are we to being done with plan?
So the question was, how many, what percentage of people in phase 1A have been vaccinated? We've gotten over 36,000 total, is that about right? And we estimate about how many of those, Angie?
About 90 to 100,000.
90 to 100,000. So we're probably about a third of the way through that so far.
When will the vaccine website be released?
When will the vaccine website be released? Well, we've got our dashboard up, if you're referring to that. And if you're talking about a way for 75-year-old or folks, I would say just stay tuned.
Will there be assistance for people over 75 who aren't able to access the website to get set up to get the vaccine?
Will there be assistance for people who are 75 or older to who don't have access to a website to be able to get access to a vaccine? The answer is yes. There'll be, as Angie was describing before with vulnerable populations, there'll be a variety of ways that people will be able to get the vaccine and be able to sign up. So, for example, your healthcare provider can register you. I presume that if you're going to a federally qualified healthcare clinic, they'll be able to do that. The answer is yes. Angie's just nodding. So there'll be a variety of ways that if you don't have that internet access, you'll be able to work with your healthcare provider or one of the clinics to be able to get signed up.
Kellen Havakan is asking, what are your priorities for the 2021 legislative session?
Kellen Hevaken with who?
KLN.
KLN is asking, what are my priorities for the 2021 session? And I would say, stay tuned. That's generally what the State of the State address is about, where we do a lot of those announcements. But stay tuned, and we'll get to those legislative priorities here in the next couple weeks.
Cecilia with WWT asks, how will the state make sure to avoid chaos that we've seen in other states trying to vaccinate vulnerable populations?
Cecilia WWT is asking, how will the state make sure that we don't see the problems that are happening in other states with regard to vaccinating vulnerable populations? And again, that's part of what the plan we're working through right now is to make sure that we've got equitable access to folks, that there's multiple ways that people can get vaccinated. And here, folks, I'd also remind people, vaccinations are not new. We've been doing vaccinations in the state for a long, long time. Local public health departments are used to doing this for a variety of populations. For example, for flu every year. So this is not something new. Now it's on a much bigger scale, but that's what we're working with all the community partners and the clinics on, is how do we actually execute this. So we are working through those plans, and we'll make sure that we're doing the best job we can to make it a smooth and efficient process.
That's all we have now.
That's all Taylor's got. All right, questions from inside the room? Paul?
I'll start. Just to be clear, so you are satisfied with the pace of the vaccinations being administered?
So Paul's question, I am satisfied with the pace. Well, certainly we would like to see more vaccines go out more quickly, but I think if you look relative to what's going on in the rest of the country and the holidays and everything, that we expect that we'll see a pickup in the pace of vaccines. And again, we need vaccinators and people who are eligible to be vaccinated. So that would be those folks that are, frontline healthcare workers, and if they're off for the holidays, then you're obviously not going to have access to them.
And, so
We covered a lot of stuff. Sorry, Paul, we covered a lot of stuff.
Well, I missed you last week. So we got a copy of an OSHA complaint about the Test Nebraska pods. If they're too small, they're not heated properly, they don't allow people to spread out, and clean supplies are not separated with soil supplies. Have you addressed that? Are
So Paul's saying there's been an OSHA complaint with regard to that. And Angie, do you have information on that? You want to come up and talk about that? Thanks.
Yeah, we did.
Remind people what the pods are too.
Sure. The pods are what the Pacific Engineering Incorporated had built out for us to do indoor and a version of indoor testing. The drive-through test sites, we have them at North Omaha, South Omaha, and a double one at Lincoln. And we did receive an OSHA complaint on that. All of that complaint has been closed. Everything was either invalidated or corrected before the complaint was even filed. So there are no current issues with OSHA.
Aren't they too short though? You can't shut the door.
Some of the vehicles are too long, and so you won't be able to shut. It's not mandatory to shut. It's just for weather. So if it's cold, they can shut them to make make it a little warmer in there, but it's not necessary.
But are you looking at alternatives? I mean, that was something we saw on one of the email screens that the state is looking at some other place to do that.
No, we're very satisfied with what we have currently. Any other questions?
When were those complaints filed?
I do not have the exact date, but I do believe it was approximately 2 to 3 weeks ago.
While you're still up here, can I ask you a question about that? Why are we lagging behind? And we've got like 94,000 vaccines that are here. Why haven't we been able to get them in arms yet?
Sure. So the question was, why are we lagging behind in vaccinations? Why haven't we been able to get them in arms yet? So you have to think through it. You have to think, not only do we have to stagger these, so this isn't just general population where anyone who wants a vaccine goes through. We have to be very careful in the way we administer this to make sure that our hospital staff does not fall out due to side effects. So it's not only has the holidays come, but we also have to be very careful about how we administer these vaccines regarding side effects. And also remember that even though the number says 94,000, some of those are the long-term care facilities, which are getting vaccinated. And also, many of those arrived very, very late last week because of some delays with the snow. So just remember the numbers of how it's working, that many of them were delivered right before Christmas and right before New Year's, so it is very difficult to get those in very quickly. Now, we do expect the next 2 weeks to be very big weeks for Nebraska.
Is the state considering changing the vaccinations? I see there's some consideration of giving a smaller amount of the dose to make doses go further.
So the question was, is the state planning to change the amount of vaccine or the way we deliver it? No. So absolutely not. We will not change the way the vaccination is given. It will follow manufacturer's directions, so they will be getting the correct amount of dosage at the correct amount of frequency.
So that isn't a viable option, you think, or does the state look at that?
It's not a recommended option. There's no reason to give something that the manufacturer has not. That would be outside of the study.
And while you're up there,
Yes, sir.
the idea of not giving vaccinations to undocumented workers, I mean, don't you leave a gap inside maybe your herd immunity or your coverage if you don't do that? Sure.
Again, the question that was asked with regard to food processing plants and illegal immigrants, and the question was, do you leave a gap if you're not inoculating people who are not here legally? And you have to be here legally to be working in those plants. So there should be no question about if you're here legally, you're working in the plants, that's when you get the vaccination.
But the reality is there are people here illegal and they could still spread the disease.
Well, again, the people here who are working if you're working in the plants, you're supposed to be here legally. So to get the vaccination, you gotta be working here legally to be able to be as part of the food processing program. So there's not gonna be a conflict here.
We have a couple more questions from Julie Anderson. She did ask, does the state need more vaccinators? She says she's heard people asking for volunteers among healthcare workers.
So Julie Anderson is asking, does the state need more vaccinators? And, again, we'll certainly work to expand the number of vaccinators as we need it, but I think getting back to what Angie says, folks, we were number 2 last week. We're in the top third this week. we're not behind. Angie said, we got some of these vaccines right before the holidays. People have been gone. You know, the next 2 weeks are going to be very big. So I think people just need to be patient here. And as Angie was pointing out, when you're talking about healthcare workers or long-term care workers, you have to phase this in because you can't have your entire staff out because they all have a side effect. So everybody just needs to be patient here as we go through the next 2 weeks, and you'll see that we have a lot more vaccines going over the next 2 weeks as we get back into a more normal schedule after the holidays.
Julia also says she's heard a complaint about Walgreens not getting vaccine out as quickly as some pharmacies, and is that true?
So Julia Anderson's also asking about Walgreens and them not getting vaccines out as quickly as some other pharmacies. Really with that, community pharmacies has done a great job of getting out their vaccines very quickly, and that's in part because they had contracts already with the long-term care facilities. That's kind of what they did already here in the state. Walgreens has to get those contracts in place, so Walgreens is behind community pharmacies in getting those out, but it's really just a function of getting those contracts in place to be able to do it. Fred?
I had a question about the monolith announcement. I don't know who it's.
Which one would you like to, Fred's got a question about the monolith.
I mean, it's been in operation. What's the news?
What's the news here with regard to monolith? It's really, I'm gonna have Rob, you come up and talk about it, but it's really about them signing a letter of intent to be able to get 2 megawatts worth of power to be able to power their operations. Remember, one of the things I said early on in this, they're generating hydrogen. One of the uses for that hydrogen, they could have used that into turning it into energy, in which case they wouldn't need to build the additional clean burning energy. But they're going to use that for industrial purposes, like by creating, like for example, anhydrous ammonia in a very clean, sustainable way. And so now, since they're going to be using the hydrogen for that, they're going to need the additional energy that needs to be renewable. And so that's why this is a big deal. 2 megawatts of renewable clean energy is a big deal for the state. So Rob, you want to come up and talk a bit more about that? Or one of the other gentlemen? Tom?
Thank you, Governor. So Rob and I flipped a coin and I won. So or lost. So the question is what's the big deal about this announcement? And the big deal is Monolith's a very large customer. Will be likely the largest customer electric consumer in the state once they're done with their construction. And they were looking to supply 100% of their facilities' needs with renewable energy. And so that's about 2 million megawatt hours of electricity a year that we will provide them under this agreement, which is enough electricity to basically power all the residences in the city of Lincoln with 100% renewable annually, to give you kind of an equivalency of that. So it's a pretty big deal. It will double, a little bit more than double the amount of renewable energy that we provide to our customers, our wholesale and retail customers in the state. So it's a big step forward for us to continue to modernize our power supply. As I mentioned at the beginning, we're roughly 60% carbon free for our customers today. This will increase that percentage significantly. And so that's the benefit to our customers, and it's a big benefit for Monolith. It's really important to them as a manufacturer to provide their products through 100% renewable power supply. As Rob mentioned, that's their largest input for their resources, and it fits their sustainability and reliability goals. And we're glad to be partnering with them and Norris in order to provide that service that's really been driven by their demand and requirements and requests for the renewable resources.
So it's going to double the amount of electricity that you have to supply. Are you going to go out and build a whole bunch of wind farms, or what are you going to do to provide this electricity?
So the question is it going to double the amount of electricity we have to supply? How are we going to do that? First off, it's as you look at our total power supply, it's an additional roughly 2 million megawatt hours a year, and so that's about a doubling of our renewable portfolio. We supply a much larger amount to our entire customer base. We have about a 3,000 megawatt load. This will be, as you look at these resources, it'll be a combination of new wind and solar farms in Nebraska. If we provided it with 100% wind, it'd be about 500 megawatts of new capacity in Nebraska. If we provided it with 100% solar, it'd be about 900 megawatts of new capacity. We're looking at an $800 million to $1.2 billion investment in the state. It's going to be a mix, though. We're going to have a mix of wind and solar, but it's going to be in that 500 to 600 megawatts of new resources that will be built or are in the process of being built to supply this.
Are these projects that are already in the works, or are you
Okay, so that's a great question. Are these projects that are already in the works, or are we building new ones? These will be new resources that don't exist today, but they might be in the works already. Nebraska is a member of the Southwest Power Pool, so all the utilities in Nebraska go through a planning process that involves interconnecting new generation into the grid. And so that planning process, as I referenced in the discussion, is their generator interconnection queue. It's likely that most of these projects are already somewhere in development in that queue. They're already been identified as a location, they've already been gone through some of the study processes, but they may not be in construction yet. And so,
depend on the R line coming into existence?
will this depend on the R project transmission line coming into existence? Not necessarily, but maybe. That's a difficult question to answer because of how the transmission system works. New projects that are identified that interconnect into the transmission queue, into the transmission system that the Southwest Power Pool studies. Part of the reason they study these projects is they have to ensure when they interconnect them that they can be reliably interconnected to generate electricity. So to ensure reliability, you have to look at what the transmission system looks like. So to the extent that their study work identifies the transmission system, and the transmission system that they're studying includes the R project, then yes, the answer is the R project should be in service in order to reliably interconnect those new resources. They don't have to be in Nebraska necessarily. They certainly don't have to be in the Sandhills of Nebraska, but it's possible, the way the transmission system works in the eastern part of the United States, that those projects, when they're studied to be reliably interconnected, are relying on that part of the transmission system also being in service.
You're going to put out an RFP for all those, for these proposals, is that right, Tom?
Yeah, that's correct. The governor asked about an RFP for the proposals, and we will put out a request for proposal, and it will identify all those requirements, and those requirements will be responded to by the various respondents, and some of them will say they need this, they need that, and we'll evaluate what the best combination is to provide the resources that Monolith needs.
So, did I hear right, all these projects that will provide us renewable energy will be in Nebraska?
The question is, will all these projects be in Nebraska to provide the renewable need? That's certainly our preference, that they're in Nebraska, but they do not necessarily have to be in Nebraska. We'll evaluate that as we go through the request for proposals.
And what is the economic development rate? How much less is that rate?
So the economic development rate, what is the economic development rate? That's a rate we provide to wholesale customers that we, in turn, they can provide an equivalent rate to their retail customers, which is the case for us and Norris and Monolith. That's based on the avoided cost for generation. It's basically based on the market energy rate, roughly, for the Southwest Power Pool market today, because that's roughly our avoided cost, and I don't recall off the top of my head what that number is.
It's less than
It's less than the standard rate significantly.
5 or 10%? 5 or 20?
More,
30% maybe?
more than 25%.
And how long do you get that?
The economic development rate's provided for 5 years. And again, it's governed by a statute that was passed by the legislature a few years back.
Can I ask Rob a couple questions? A lot of concern about your project and how much water it uses. How much water will your project use?
Sure. The question is about how much water will our project use. So our project is going to use roughly 1,000 acre feet per year, which is a large amount of water, but it's a reasonable amount of water for the amount of products that we're producing. So we'll be producing 300,000 tons of anhydrous ammonia. That's almost half of the state's demand. We're also going to be producing roughly 200,000 tons of carbon black, and that's roughly 10% of the nation's demand. And so, these do take resources. 1,000 acre feet, we're now studying with Olson and some of the leading hydrogeologists. And the early read is that there's lots of water. This is from a renewable aquifer, so this is not a finite resource. Every year the aquifer is recharged as the rain falls and seeps into it. And so we're doing that detailed study, and our number one mission is to have a positive environmental impact. So we're going to live by that, and we're going to study this in great detail and very confident that the water resources are available there without having a negative environmental impact.
This project was sold as a project to produce energy from hydrogen, and now you're going to produce anhydrous ammonia. It's a much different project now. What can you say to people that think, wow, we got kind of sold it, you know, we thought we bought a cow and now we got a horse?
I'll do my best. So the question is, when we first proposed this project, we were going to use the hydrogen to fire an existing coal-fired power plant and produce electricity, and now we are going to be instead converting that into anhydrous ammonia. And what would I say to people who say I may have sold a cow and now they got a horse? So I would say, look, we have not been perfectly consistent over 10 years of life as a company. We're a startup and we go where the economy takes us. And we work very hard to try and make the deal work of selling hydrogen to Sheldon Station as a fuel. The reality is that hydrogen as a chemical building block for anhydrous ammonia is much more valuable. And so the economics took us that way. Without it, we wouldn't have a project. And so that's part of building the business, particularly a startup business, is you have to be responsive as the market changes. What I'd say more broadly to people who may criticize us for not living up to what we've said, I mean, my presence here is one of living up to that. I mean, I've moved my family, my kids, my wife to the state, and we've done that with dozens of families from California. And we've also added close to 100 jobs. We've put $100 million of steel and concrete into the ground, and we're now producing products at our plant. So we're not perfect, but I think generally we're living up to the commitments that we make.
What are you producing there right now?
So what are we producing at our plant right now? So our plant has two phases. Olive Creek 1, which was phase 1, that is now operational, and it's producing carbon black. We'll start shipping that carbon black to customers in the first quarter of this year. It's a huge milestone. First new carbon black plant built in the country in 3 decades, and the only 100% clean carbon black plant in the world. So first, this is going to go to customers who make various packaging. So it's, if you think of black plastic packaging, whether that's for food products, medical equipment, they have huge demand right now for obvious reasons. So we're going to be supplying them. And then we're also working with automotive companies to be supplying in the second half of the year. Now, the second phase is Olive Creek 2, and that's an expansion to that plant. Roughly $1 billion investment. That's what this announcement today is about on the electricity side. And that one we're hoping to break ground in the second or third quarter of this year.
Why Nebraska and not California? What advantages did you have in Nebraska?
So the question is, why Nebraska and not California or somewhere else? What are the advantages here? So in 2014 and 2015, we spent a 1-year search around the country, also outside of the country. Our finalists were the state of Louisiana, Nebraska, and the province of Alberta. And what brought us to Nebraska was affordable, reliable, and now with the potential and the announcement today, clean electricity. The economic development rate is a big part of that. That was something that attracted us over some of those other states. Very good infrastructure. Good roads, good rail, center of the country, a really good environment from a political and business perspective, can actually get stuff done here. And then finally, the community. I mean, we were welcomed into the state by the people here, the governor, Tom, Bruce, and they really wanted us to come and do some of this economic development, take a little bit of risk on a company like us. And so that's why we ended up in Nebraska.
We have time for just 1 or 2 more questions.
Governor,
Just to say, hey, Paul, also, you said something was a misstatement earlier. This project was not sold as a hydrogen burning project. That's part of what the project was. It was really brought to us, though, as a production for carbon black. The first one, as Rob was saying, in 3 decades. That was the big deal about this. It was about producing the carbon black. The burning the hydrogen in a utility-style fashion was part of the benefits. And as Rob said, that plan changed as it became more economically feasible to create the anhydrous ammonia. But the original concept of this plant, the reason that we attracted it and wanted it here was for the carbon black factory.
But they are 2 different things.
The question is, are they 2 different things? They are 2 different things, but the original reason for bringing them here was carbon black. It was not for the hydrogen part. It was for the carbon black. Yeah. That was always, all along, Paul, it was always about the carbon black factory. That's what we were talking about.
Is that your main income source? Will that be your main?
So the question was, is that your main income source there, Rob? Yes, the answer is yes. Andrew.
Have you already parlayed this into other startup businesses, other businesses that want to come to Nebraska because
So the question is, have we gotten other businesses here because of the carbon black or the anhydrous production here? Off the top of my head, I don't believe we have anything we can trace directly to Monolith Materials being here, unless Rob, you know of anything. Doesn't look like Rob does right offhand. But again, if they're just going to be delivering carbon black to their customers for the first time in the first quarter of this year, you know, obviously this is something where once they get that production up and running, we may see other businesses come here. And certainly when it comes to anhydrous ammonia, that's something that we use all over the state as the, you know, number one industry in our state is agriculture, and using anhydrous ammonia for fertilizer is a big deal for us. So that's something that's going to greatly benefit the folks here in the state.
Time for the last question.
One last question. All right, Andrew, you get it.
Sorry, I had a question about, I have a viewer that has a immunocompromised child and can't go to school, hasn't been able to go to school. And it doesn't sound like kids are in the vaccine program. What do these families that have immunocompromised, you know, children who they feel are missing out on school?
So the question is, there's a viewer that Andrew has that has an immunocompromised child who hasn't been able to go to school because of the pandemic, obviously, because they're protecting the health of the child. And the vaccine has only been tested in people who are older than 16, and so that child's not eligible to get the vaccine. And I know that's really tough on the families, and they're certainly going to have to continue to manage this for the foreseeable future. And at some point, what I would expect is that the manufacturers will do that study on children with regard to you know, the safety and effectiveness, and at that point the child will be able to get vaccinated. But again, you can't vaccinate the child until you've done those studies to make sure it's safe and effective. So you know, the unfortunate news for that child is until those studies are done, you just can't give that vaccine to a child. Well, again, folks, thanks very much. Appreciate it. Just a reminder, continue to follow all of our rules with regard to slowing the spread of the virus. We need to continue to focus on that even as we have these vaccines being rolled out. And then also a reminder that Wednesday, we will be here at 9:30, not 10 a.m., and we will do a short press briefing. We will be talking about the new strain of virus that has been discovered in the UK and now in other states like Colorado. But it'll be a very brief press briefing because the legislature will gavel in at 10 a.m. and we want to be wrapped up before they gavel in. And then finally, we'll do another press briefing on Friday at 10 a.m. Thank you all very much, and Happy New Year. Have a great week. Thank you, Francis.
Have a good week yourself.
I will.
I'll see you.
All right, see you Wednesday.